We turn to 5 on your health tonight, and it's not just measles that are making a comeback. There's a new report that says doctors are treating more Americans for diseases that vaccines can actually prevent. As you can see, Dr. Todd Ellerman joins us right here from South Shore Health. Happy Tuesday. Good to see you. So let's start with question 1. You've talked a lot about measles on the air here and measles infections. Why do some doctors say it's a benchmark for public health?
It's the canary in the coal mine. Because it's the most contagious infection, when you see cases rising, it means there's a breakdown in community immunity, or what we call herd immunity.
Right.
And it signals that other vaccine-preventable infections that are less contagious are going to follow.
So it's a good indicator. I like the canary and the.
And remember, now on a U.S. level, we're in worse shape than we were last year. There's almost 2,000 cases of measles. In Massachusetts, there were 2 cases in February. Neither one of them were acquired here. But the good news about Massachusetts is it was limited, which means our community immunity was high enough.
So let's talk about some of those preventable diseases. So what is out there right now that doctors are surprised to see?
Right. I could list a bunch, but one of them is whooping cough, or what we call pertussis. We're seeing a significant increased rise, really a post-pandemic increase. Rotavirus, which is, you've heard of the norovirus, the diarrheal illness. In infants and young children, rotavirus can do something similar. That's on the rise. We are seeing, with the decrease in vaccine uptake, we're seeing an increase. We're seeing a spike.
Have you ever had a patient just flat out refuse to get a tetanus shot? Just flat out say no, or something, other vaccine or something, and even after you've said this is the risk and this is why, and boom.
Sure, and I'm going to give you an example. A couple of months ago, patient came in, had moderate to severe COVID infection. His parent, one of his parents, died from COVID and was unvaccinated. He was unvaccinated. So after I asked him, are you willing to, in the next 6 months, let's say, get vaccinated? And he said absolutely not. And he didn't really want to discuss it further, but what does it tell us? That vaccine confidence is fragile, Eddie, right? Whether it's because of just personal autonomy, you want to make your own choice, whether it's because of fear or mistrust, whatever it is, it's complex, and it's something we're going to be dealing with for a long time.
Dr. Ellerman, it's great to see you.
Good to see you, Ed.
Thanks for coming in on Tuesday. Maria.